everyone, my name is Ashley Warganovich. I decided to do my informatics project on barcode medication administration. I wanted to use this topic because we use this system in the hospital that I work at, Penn Highlands Du Bois, and it helps to allow me to put patient safety at the forefront of the care that I am providing. To start off with, barcode medication administration, or BCMA, is a system using barcoded technology affixed to the medication, the patient ID bracelet, and the nurse ID badge to support the 5 rights of medication administration. Upon admission to the hospitals, each patient is given a barcoded wristband specific to their identity. Before administering any medications, the nurse scans the barcoded wristband and then scans the medication. If there are any differences between the patient and medications and the electronic medication administration record, then a notification will pop up. By 2011, the technology had been implemented in 50% of the hospitals in the United States. By incorporating the BCMA systems into healthcare facilities, we are allowing ourselves to provide the best quality and safest care possible to our patients. In 1999, death due to medication errors became the 8th leading cause of mortality in the United States. This number is truly astounding to me. I always knew that medication errors caused a large number of mortalities, but I didn't know that it was that high. Since 1999, according to Johns Hopkins researchers, deaths from medical errors, including medication administration errors, has become the 3rd leading cause of death in the United States, behind heart disease and cancer. This rank is far higher than it needs to be, and we need to be proactively attempting to perform the safest care for our patients. The first problem regarding patient safety involves medication errors caused by failure to verify the right patient, medication, dose, time, and/or route. When we are not accurately checking patients' identification and medication administration records to ensure that we are administering the correct medications, we are setting ourselves up to cause administration errors, which could greatly impact our patient's health or worse, lead to their death. Why use barcode medication administration? Barcode medication administration is recommended for the prevention of medication administration errors because it allows the nurses to verify the 5 rights of medication administration. As we know, the 5 rights include right patient, the right dose, the right drug, the right time, and the right route. By scanning both the patient and the medication, we are allowing ourselves to make sure that we are providing medications to the correct patient. We are also making sure that the medications we are attempting to deliver is the correct drug, dose, route, and that it is being given at the correct time. The BCMA technology confirms that the nurse is administering the medication correctly to the correct patient. If the medication or patient is incorrect, the nurse is notified, giving him or her a chance to correct the error prior to giving the medication. When we have the patient's chart pulled up on the computer and begin the medication administration process, the first things we need to do is scan the patient's wristband and ask them their name and date of birth. If we are scanning a patient and it is not the same patient that we have the chart pulled up for, we will get a notification advising that the patient scanned does not match the patient's chart. This is the first warning we have to correct our actions and ensure we are administering the correct medications to the correct patient. The same notifications arise when we are scanning medications that do not match the orders provided for that patient. This safety mechanism allows us to ensure that we are keeping all of our patients safe during the medication administration process. Based on initial studies, BCMA technology appears to be cost-effective and reduces administration errors by over 50% and serious errors by up to 25%. As mentioned before, using the BCMA system allows us to prevent medication administration errors, which can lead to more complications for our patients. The research shows that by introducing the system, we are cutting the number of medication errors in half, which in turn is reducing length of stay for our patients and costs. Short-term effects on practice and client health. It has been estimated that when adverse drug events occur in the hospital setting, they increase the patient's length of stay by an average of 4.6 days. When we increase the patient's stay in the hospital, we are also increasing the chance for hospital-acquired infections, bed sores, anxiety, depression, costs, and more for that patient. These medication errors are preventable, and by using the BCMA system, it decreases the potential for those said errors. The implementation of the electronic medication administration record and barcode medication administration technology improved patient safety by decreasing the overall rate of adverse drug events and the rate of transcription errors. Patient safety is at the forefront of our jobs as nurses. It is our duty to make sure that we are doing everything in our power to provide the safest care possible to all of our patients. By implementing these electronic systems into patient care, we are allowing ourselves to do just that. The BCMA system reduced harm caused to patients from administration errors by allowing for early identification of errors. As soon as we begin the BCMA process, we're scanning the patient's barcoded wristband. Immediately, if that patient's wristband does not match the patient's chart, a notification pops up alerting nurses to double check that we have the correct chart open, or are scanning the correct patient. Again, if we are attempting to administer a medication and it is not the correct dose, route, drug, or time to administer that medication, then a notification pops up, and we need to determine the reason that we are receiving the pop-up. This gives us time to investigate if the drug truly needs administered. Long-term effects on practice and client health. Preventable medication errors during inpatient stays in the U.S. hospitals cost an estimated $16.4 billion annually. That is $16.4 billion annually that hospitals do not need to be paying. These medication administration errors are preventable, and with the use of the BCMA system, electronic medication administration records, and computerized physician order entry, we can prevent even more. The barcode medication administration helps nurses deliver safer patient care, efficiently manage patient information, and improve documentation. As mentioned multiple times before, providing the safest care to our patients is critical. However, the BCMA not only helps with safety, but it helps the nurses to accurately document medication administration through the use of the electronic health record and the MAR as well. The BCMA has the potential to improve compliance with the requirements to check patient identity before administering medications and to chart the administration of medications on the MAR. By incorporating the BCMA system into our healthcare facilities, it is requiring nurses to verify the patient's identity before administering any medications at all. We are required to scan the patient's wristband in order to continue in the medication administration process. Unfortunately, we are still able to give the medication without scanning it, but when we give the medication without scanning the patient first, it is then documented and a reason needs to be given as to why the patient was not scanned. So when we're not scanning the patient first, we then have to go back. A little red flag is put up in the electronic health record saying that we did not scan the patient first and that a reason needs to be put into as to why. Barriers to implementation. The cost of technology solutions such as computerized physician order entry, barcode medication administration, and electronic health records remain staggeringly high. Cost is always a factor when it comes to any sort of technological advancement, so unfortunately many hospitals may not have the funds to incorporate the BCMA system into their facility. It is not just the cost of initial placement that needs to be considered, but also the cost of upgrades, maintenance, training, and etc. Unfortunately, many small, especially rural hospitals, may not have the finances to implement the system. The lengthy timelines required to develop and implement such technology has put this endeavor out of reach for many healthcare organizations. Incorporating an electronic system like BCMA isn't an easy process. It takes time and money, which again, some healthcare facilities just don't have access to. Despite the promising advances in patient safety afforded by this technology, it is not fail-safe. As with any electronic system, there are also downfalls to the BCMA system. When the computer system goes down or you lose power, you lose access to the system, which can inhibit patient care due to the fact that you are unable to see which medications need administered and when. Even when used properly, BCMA isn't intended to replace clinical judgment. The most important thing to remember when using the BCMA system is that it cannot make the decisions for you. Despite the computer telling you which patient needs which medications, the time they need them, the dosage, and the route, you need to use the best nursing judgment in order to properly care for a patient. If your patient is, let's just say, ordered metoprolol, but their heart rate is 50, just because you're able to scan the medication and administer it doesn't mean you should. Your best judgment needs to be used, and the doctor needs to be notified before you continue with that administration to see if it is appropriate for that patient. A number of workarounds can occur, such as failure to scan the patient, wristband or medication, failure to follow alerts and parameters, and failure to follow policy. It is critical that when there are parameters, for instance, let's just say on blood pressure or heart rate medications, that those parameters are being followed unless otherwise advised by the physician. These parameters are put into place to maintain the safety of the patient, and by ignoring them, we are not providing the best care to our patients. If a medication is not meant to be due until evening because it was given late the previous day, then ignoring the warning about early administration could potentially be harmful to that patient. Regardless of the cause, workarounds negate BCMA safeguards and impose significant risk to medication administration safety. Despite being able to use workarounds to administer medications, it does not mean that nurses should. Will we ignore the pop-ups, do not scan our patients or medications, or ignore parameters written in the order, then we are just opening our patients up for medication administration errors and harm. Other than cost, one of the barriers to widespread adoption of the BCMA technology is the lack of definitive evidence that BCMA actually reduces preventable medication errors, especially in hospitals that are already using other safety systems such as computerized prescriber order entry and automated dispensing devices. Recommendations for implementation. Establish institutional policies and procedures that can be easily implemented when products fail to scan. The best way to incorporate the BCMA system is to have a definitive set of policies and procedures that employees are able to look up and follow when any part of the medication administration does not go according to plan. Having these policies and procedures allows staff to potentially self-solve issues that they are having. Technology that's designed to improve patient safety is only as good as the person using the device. It doesn't replace critical thinking, solid nursing practice, and careful patient monitoring. Although the system is able to help tremendously to prevent patient harm by way of avoiding medication errors, it is still the nurse providing the care for the patient. The nurse needs to be monitoring the patient for any sort of problems and attending to them appropriately. The nurse needs to use clinical judgment in order to identify problems with the BCMA system or any harm that may come to the patients. To effectively reduce medication administration errors, BCMA must be used at the point of care. BCMA coordinators must continue to reinforce this during new employee orientation classes, daily walking rounds, and email communication. In order for the system to work to its full potential, the system needs to be used appropriately. If you are giving medications and then going back later to scan the patient in the medication wrapper, then that defeats the entire purpose of the system. The BCMA system needs to be used at the time that you are administering the medications to the patients. BCMA coordinators need to continue to educate new and old employees upon the proper usage of the system in order for everyone to be using it appropriately and for our patients to remain safe. Form a multidisciplinary task force of nurse leaders, pharmacists, and frontline nurses to gain widespread buy-in and provide accurate assessments of implementation barriers. It is critical to involve healthcare employees who are actually using the system to determine any downfalls of the systems or workarounds that staff could be using. They're the ones using the system day in and day out, so they have the best knowledge of how to incorporate better ways to avoid those workarounds or to fix the problems that they are having. Structures and processes that enable continual evaluation of BCMA use and impact on nursing practice are needed to ensure adherence to best practice and minimize the potential for error. Staying up to date on all of the updates and usage of the BCMA system will allow the healthcare facilities to continue to provide the best care to all the patients. Allowing for evaluations of the system will allow for staff that uses it to express any questions or concerns that they may have. Addressing these questions and concerns would allow for the BCMA system to stay most up to date on best nursing practice and continue to prevent medication administration errors. In summary, Barcode medication administration is implemented in order to provide the safest and best quality of care to all patients. By incorporating BCMA into the hospital setting, medication errors are decreasing. Using the BCMA system, we are decreasing patients' length of stay due to medication errors, as well as decreasing costs to the healthcare system. There are many barriers that need to be overcome in order for the BCMA system to work to its full potential. If followed correctly, the barcode medication administration system can lead to healthier, safer patients. Attached to this slide is a full list of all references used to create this presentation. Thank you so much for listening.